My name's Shannon.
I'm Vienna.
So we're going to be testing the 12 different cranial nerves to test for a concussion. So before testing your patient, you must provide privacy to the patient, hand sanitize, and explain the different procedures that you're going to be doing. So for cranial nerve 1, or the olfactory nerve, you're going to be testing the patient's sense of smell. So you're going to be asking your patient to close their eyes, and when they close their eyes, you're going to wave something underneath their nose, and they're going to have to identify the smell. So close your eyes for me and smell. So what was that? Good.
It was
So she got it. That was biofreeze. So unfortunately we didn't have anything pleasant for her to take a whiff of, but if you do, I would recommend that for you.
Hey guys, so right now we're gonna be testing cranial nerve number 2, which is the optic nerve, and it tests for confrontation visual field, which is the patient's peripheral view. So first, sanitize the hands. Okay. So for this test, I'm gonna stand arm's length away from you. Okay. You're gonna cover your right eye, and I'm gonna cover my left eye. You're gonna look me in the eye, and then I'm gonna come over here and I'm gonna put numbers out, and you're gonna tell me what numbers they are, okay?
Mm-hmm.
Great.
5, 3, 2, 4.
Good job. Her thing is intact. So next, we have to test the Snelling chart. Do you wear glasses?
I don't.
Okay, so if the patient were to be wearing glasses, you would make them put their glasses on for this test. But since Shannon doesn't wear glasses, we don't need to do that. So stand on that mark for this next test, and you're going to tell me what that board says, okay? So cover your right eye and tell me what it says.
X, R, B, V, Z, S.
Good job. Now cover your other eye and do it.
X, R, B, V, Z, S.
Yes, good job.
Also, for your last test on that, you would have the patient use both eyes, but we know that we're fine, so we're gonna
She got 100 on both,
skip
so
that part,
yeah.
you know. Okay, guys, so now we're gonna be testing cranial nerves 3, 4, and 6, the ocular motor nerve, the trochlear nerve, and the abducens nerve. So for this first test, we're gonna be holding a pen 12 to 14 inches away from the patient's nose. They're gonna hold their head still, and you're gonna move the pen in the 6 cardinal field gazes. So that's up and down diagonal, then up and down diagonal the other way, and then laterally. So yeah. So focus on the pen. Don't move your head. So for that test, you just make sure that they don't have involuntary shakiness in their eyeballs, and she obviously passed. So now I'm gonna dim the lights. Okay. So now I'm gonna dim the lights. I'm gonna have her stare off at an object like across the room. So stare at that Adelphi Lacrosse logo. So you're looking for pupil dilation. What's it called? Yeah. They did, so she passed. Now you're gonna turn it back on. It's gonna be really fun to edit. So now I'm gonna hold the pen again 12 to 14 inches away from her face and bring it into her nose and then back out. And she's gonna follow the pen. You can see the eye track. So stare at the pen. So she passed. So her cranial nerves 3, 4, and 6 are all in check.
Okay. We're gonna be testing cranial nerve number 5, which is the trigeminal nerve, which is your mouth and your jaw. So this tests your mouth and your jaw. So first we're gonna sanitize our hands. Get really nice and sanitized. Okay. This smells bad. Okay. So I'm gonna make you clench your jaw.
Okay.
And then I'm gonna feel here and here.
Okay.
Okay. So clench your jaw. Okay, unclench. Wait, go back. Try to open your mouth. Okay, go again. Okay, so, that nerve is intact. I hope so.
Okay, so now we're going to be testing cranial nerve 7, and this is the facial nerve. So basically, you're going to have the patient do a bunch of different facial movements, and you're going to see if they can do it with ease or if they have difficulty completing these movements. So close your eyes really tightly. Okay, open them. Smile. Frown. Good. Puff your cheeks out. Good. Okay, so as you can see, she completed all the different facial movements without difficulty, so her cranial nerve 7 is...
Okay, guys, so now we're going to test cranial nerve number 8, which is the vestibulo... So first, sanitize your hands. Great. Okay, so for this, you're going to plug one ear, and then I'm going to go on the other side, and I'm going to say something, and then you're going to repeat what I said.
Okay. Blue. Pig.
You're good.
Cat.
Okay, so Bella can hear.
Okay, so for cranial nerve number 9, the glossal paraneglia, you're going to take a popsicle stick and have the patient stick their tongue out, put the popsicle stick out, say ah, and you're going to make sure that their uvula is going up while they say ah. Next, sorry, you're just going to take this. Wait, open. Okay, so as you can see, her gag reflex is working greatly. So basically for that, you just take a popsicle stick and you trigger their gag reflex and you see if they have one that's working. If they immediately throw up, you know.
Okay, next for cranial nerve number 10, which is the vagus, it just makes sure that you can talk and swallow, and she's been doing this throughout the entire evaluation, so that is intact.
Okay, so for cranial nerve 11, this is the accessory nerve. You're going to have the patient move their head from side to side, up and down, and then you're going to have them shrug their shoulders against resistance. So move your head from side to side, like shake it, yeah, there you go. Good, now move your head up and down. Okay, now shrug your shoulders. So as you can see, she completed all these movements with ease. Okay, so for cranial nerve 12, the hypoglossal nerve, you're going to have them stick their tongue out. Stick your tongue out. And just shake it from side to side. No, your head, just your tongue.
Just my tongue?
Yes. So as you can see, she did that with ease.
Okay, that's our evaluation of the 12 cranial nerves. I hope you guys enjoyed as much as we did.